Welcome everybody. Thanks for joining us this evening on our webinar all around CQC compliance and how to start off on the right foot post-registration. So we've got about a presentation for about sort of 20 minutes or so, and then a Q&A. So hopefully we'll be sort of wrapped up by 10 past, quarter past 7. If you do have any questions for myself, Dion, or Sarah, who I'll introduce you to in a minute, please use the chat function or the Q&A function in your Zoom bar. We've got plenty of time for Q&A at the end. I think the other thing just to mention is obviously you just heard the recording sound. So we're recording this webinar. So if you want to revisit this or share it with a colleague who can't attend this evening, then please do. We do send around a webinar deck at the end with all of the recordings of the webinars over the course of the last sort of 15 months or so. So if you can't make tonight, there's no need to panic. So today is all about CQC compliance, but if you haven't been to these webinars before, we've been running them now for over a year. I think March last year was the first one that we ran, and it's all about guiding you through the essential steps to helping you launch and grow and succeed in private practice. So, this is what we do day in, day out. So we bring in guest speakers on various different topics, looking at CQC or finance or marketing. But the idea is to help you gain a better understanding of how you can be successful in private practice, helping you avoid those common kind of pitfalls and mistakes, saving you money in the process, and obviously helping you get those patients in the door and generate those revenue streams that you want to generate. So that's what the webinar series is all about. These are just some of the topics that we've covered over the course of the last year. So as you can see, everything from finance, we've done quite a few on CQC. That's always a hot topic. Medical indemnity insurance, we've talked about pricing, patient reviews with Doctify. But the last couple have all been around kind of CQC. So the next one, which we'll come on to a little bit later, is all around spotting the signs. We know how busy you all are, when you might need a PA or a medical PA. That's a different topic that we're doing for June. And we've got some new ideas as well coming into the autumn after we take a break for the summer. So all of these are available on request. So do just drop us an email at the end of the webinar and we'll be able to send you a PDF with links to all the recordings. And should you have specific questions, then please get in touch. If you're not familiar with Designated Medical, we have been around for about 15 years. We started out as a medical PA company, and we've developed and grown. We're now a full service consultancy for private practice practitioners and private medical clinics. We have a full suite of services, everything from sort of medical PA and practice management, right the way through to billing, finance, accountancy, marketing, and CQC, which is obviously one of the topics which is a bit of a hot topic for us at the moment. We get a lot of inquiries coming through about both registration and compliance. We have covered off registration a couple of times already. Today is a new tax. We're talking all about compliance today. So post-registration. Love to introduce our speakers this evening. So Dion and I have worked together for a number of years. She is designated as head of medical operations and gets involved with the CQC side of our business and heads up the CQC consultancy team. Sarah, we're delighted to invite as our guest speaker tonight. She also works with Designated and is a very experienced CQC registered manager and has worked at the Harley Street Dermatology Clinic as a registered manager and practice manager. So welcome to you both. You all know me. I host these webinars each and every month. I'm the Chief Marketing Officer at Designated Medical. Now, today is all about CQC compliance and understanding your key responsibilities, the common pitfalls, and just helping you through those practical steps to ensure that you remain and stay inspection ready right from the very first day after your CQC registration. Typically, what we see is sometimes doctors relax. They're so relieved to get through CQC registration, they forget about the importance of compliance. So we're going to be talking through how to build a culture of quality and safety from that first day when you get your CQC registration, how to evidence compliance, and this idea of which the CQC are always looking for, that idea of kind of continuous learning and improvement. What to expect from your first CQC inspection. So Sarah and Dion will talk you through the timings for that, but also what to expect from that first inspection. And then we'll also talk you through some recent case studies and questions from CQC inspections and interviews. And then finally, a Q&A with Dion and Sarah. So they're very experienced. They're happy to take any questions. We've had a few that have been submitted beforehand, yes, that's probably enough from me. So I'm now going to hand over to Dion. I think you're going to talk a little bit about some of the basics around quality statements and the fundamental standards. Over to you.
Great, thanks, Simon. So we'll touch on this very quickly because obviously this is the basics of CQC, and I'm sure many of you are already aware of the fundamental standards. It's basically just all the key areas of care which should never fall below the standards that are set by the CQC. So it covers all of the things on the slide: complaints, safeguarding, duty of care, all the things that I'm sure you're very aware of. We have actually had a webinar that goes into these first two slides previously. So if you are interested in learning more about the fundamental standards, then please reach out to the team. So quality statements, again, it's all based around the standards of care. So in practice, this means ensuring that patients are safe, that you're delivering evidence-based care, showing compassion, you're effective, you're responsive, you're well-led. Every part of your service should basically align with these principles, not just for inspections, but as a standard of excellence going forward. Next slide, please, Simon. So in terms of best practice in the CQC, we recommend that you have a monthly meeting session where you go through the following steps to ensure that you're following the best practice standards and that nothing that comes up is going to be a surprise. So the first thing we would always recommend is a total audit and gap analysis. This is key to any practice because it's going to tell you where your gaps are. And actually everything else from numbers 2 to 10 will very much be dependent on what comes up in the audit. So policy reviews, complaints, audits, accidents and incidents, near misses, your headcount, your staff recruitment, HR, patient records, infection and prevention control, anything to do with your premises. So if you are using rooms or you have your own premises, you need to be looking into the health and safety of the site, the rooms, and then obviously equipment. So these are what you should be looking at on a monthly basis. Normally, a meeting within your team is sufficient, but if you're looking at these things every month, it's going to be much, much easier for you to continue with the standards that are expected should there be an inspection. Culture is really important. Sarah and I will probably agree on this, but building a culture of quality and safety from day one is your key responsibility. And if you can do this and you can follow the points that we've put down on the board, such as standard operating procedures, having robust frameworks in place, teamwork and delegation is extremely important because all of these things are going to help you create a culture that creates compliance and excellence going forward. So that again, when you are due an inspection or you get notice of an inspection, you don't feel like everything's gonna, be wrong and you've not got everything in place. So if you're following all of these, then your culture will really, really set the scene. Next slide, please, Simon. So evidence. Now, this word is really scary, but actually, if you break it down, if you have standard operating procedures in place and you're following them, which you should as part of your best practice standards, then actually everything should be evidenced. So the golden rule is that if it isn't evidenced, it didn't happen. You need to be able to prove everything. And this is why it's really important to involve your team and to delegate properly. One person having to do everything can be really difficult. As a team, you can all take responsibility for various different parts of the compliance, and eventually everything will become, one whole unit, and it will be far more successful. Keeping evidence folders is really important. You need to have this all mapped out for any type of inspection and have, we always suggest printing things out as well as having things on your desktop or wherever it is that you choose to keep them. HR and governance obviously is really important. Audits, and these are part of your daily routine. So when I go back to the word evidence, if you're checking your fridge and you're following your processes, all of these audits should be in place anyway. Capturing patient feedback is really important, because that's obviously going to be evidence that you're following a lot of the fundamental standards. So that's really key. And diarising key dates so that you can keep up to date, especially when it comes down to your premises. So HAT testing, gas certification, insurance, health and safety, but basically everything that you can think of. I think that's it. I don't think I've missed anything on that one. Next slide, please, Simon. So what to expect in your first inspection. Be prepared. You'll be given a couple of weeks' notice, obviously. You need to know the 5 key questions. Is the service safe, caring, effective, responsive, and well led? You need to organise your evidence, have everything mapped out. Your team need to be up to scratch on everything. They need to know their policies, the processes, everything that's going to be relating to their role and to the clinic. Test your systems, run a mock inspection, spot checks, really important, and obviously be ready to explain how you deliver on a daily basis. So I think, Sarah, if you'd like to continue with the next slide.
Okay.
I'll just move on. Thanks.
So being interview ready is really important. We recommend using the STAR example, which has always helped me on my pathways, but looking at the situation, the task, the action and result. So thinking of a question that you might be asked, it could be, can you give us an example of how you improved safety? So the situation could be that we had repeated issues with incorrect sharps disposal. We needed to reduce the risk and improve staff practice overall. We could run a short refresher training, add posters near the bin, update our induction process. And as a result of that, we had no further incidents for the next 6 months, and we've gone for the full loop, and that would be a good answer that's ready for one of the inspectors. So it's good to practice these with your teams and anyone that's going to be speaking to the inspectors. So a case study that we wanted to talk you through was the clinic that I used to manage and look after, which was the Harley Street Dermatology Clinic. And we really worked hard to build a culture of quality at this clinic. So when I was practice manager there, I was leading the clinic through the initial CQC registration process and worked very hard on embedding robust policies and governance systems to make sure that things worked really well and that the team knew what they were doing. We had such a strong focus on all of the staff training, tracking our evidence, having a culture of openness and honestness. Every mistake is an opportunity to learn. And my team felt really able to come to me and speak to each other about things that went wrong, and so that we could learn from those experiences, make the improvements, and actually use that as a great example for evidence for the CQC. At our first inspection, after we'd set up, the clinic demonstrated really strong compliance with patient-centered care as the focus. I introduced routine audits, an audit schedule and diary. Everybody knew what was going on. We had feedback loops, monthly team meetings where we would talk about all of the things that we needed to hit in a CQC meeting, things like safeguarding, infection control, feedback, things we could improve on, who all of our leads were. We do quizzes, things like that. And now the clinic operates on a day-to-day basis with CQC readiness as part of its daily practice, not just for preparation and the last minute panic. So yeah, it's a good place to be in the end. Some example questions that you might want to prepare for, well, we've used safe as a category, but for example, how would you ensure patient safety on a daily basis? You'd be saying things like risk assessments, staff training, protocols, following your SOPs, for example. Another question could be, after a serious incident has taken place, what steps would you follow? So making sure that it's reported in the right process, that you investigate the risk, find out what's gone wrong, fix those things, and then communicate and feedback to everybody and learn from that mistake and make sure everybody's aware, so that you can prove your continuous improvement and make sure that you're operating safely. What training staff receive to keep people safe from harm, and then you'd be going through your health and safety training, infection control training, incident report training, and probably other things depending on where you're operating and practicing. So the key takeaways from today is that CQC compliance is continuous. It's not just for the first 6 months. It's a really great place to start with a full CQC audit, just to find out exactly what's missing, know where your gaps are, and have a focus of what you need to do to be ready. Culture, embedding that culture of quality from day one, communicating with all your team, delegate, use everybody. It's a big job. It's impossible for one person, as Dion was saying, and it's just really helpful to have everybody feeling that they're a part of it. Evidence, if it's not documented, it doesn't exist. So that just is really, really important. It's so easy to forget to do the daily things, and that's why it just has to be ingrained as part of the routine. And if you're not feeling comfortable with CQC compliance, you're probably not ready. So it's important to get prepared.
Sarah, Dion, that's great. Thanks very much for that overview. I know you've both got a lot of experience with CQC, and so I'm just going to bring my slides back. Apologies. Please use the chat function, everybody, should you want to ask any questions. So we've had one just coming through from Patricia. Hi, what is the rate of success passing this type of inspection on small clinics, sole practitioner-led private practice, please? Dion, that one.
Yeah, so I can't give you a percentage, but what I can say is that if you are doing all of the things that we've said, you will pass. It's very, very rare for them to not pass you. You would have to be doing something really, really wrong. And if you failed, then there's a bigger problem. What I would say is that you just need to focus on what you can do well, and during an inspection, always, if there is something where you think, actually, I haven't thought about that, or we're not doing that, you just need to be really honest and have a conversation with the inspector to show them that you are aware, you're considering it, and you can put these things into practice going forward. They really just want to know that you want to be compliant. They want to see that in you. So if you can show that, there's absolutely no reason why you would fail. Just to add to that, you will be passed, but if they have concerns, so let's say, for example, if you're not following your onboarding procedures and taking down the DBS certificates for new employees, things like that, they may then check on you again quite quickly. So you might find you hear from them within another couple of months. It might be 3 months, it might be 6 months, but you will hear from them again soon. And they'll just want to you to show them the evidence that you're still following the process and that you're actually doing this better. So there's 2 ways to think about it.
Brilliant, Dion. Thank you. Sarah, is there anything you want to add to that at all?
Yeah, so just the next question that came up was what does the CQC do if one fails? I worked with one practice before that didn't meet the standards, and actually they really highlight in the report where you're not quite meeting the expectations, and we had a good report to work through. We then had 2 weeks to put together an action plan as to how we were going to improve those levels, and then we could take that away as a piece of work with the team and then try and collect the evidence of how we were going to implement better levels of care and make sure we were safe. Then we had a re-inspection after that, and we'd satisfied the points that they were missing and they marked it up. So you do get an opportunity to improve.
Yeah, that's great. So yeah, I was attending an event a couple of weeks ago where it was all around the how to challenge the CQC and the right process. And what was interesting when I attended that was about using the language that CQC wants to hear, because often you can be quite emotional when it comes to not perhaps hitting the standards even though you've been working very hard. And again, if that's something you need help with, do get in touch, because the approach that we recommend is perhaps is worth finding out a bit more about. So we've had another question come through from Samir. Do you offer stationary templates for the evidence keeping? So Sarah, do you want to take this one?
Yes, we've got lots of different templates suitable for different clinics. We've got online trackers, paperwork, schedules, checklists. We do have a lot of documentation that fit. So depending on what your clinic needs, we can provide those templates.
Yeah, and we'll leave our details at the end, Samir. So if you want to drop us a note, we can set up a call and talk you through what your individual requirements might be. I was interested, Sarah, when you were talking earlier around mock inspections, and that's something we get asked quite a lot about. Obviously we do mock interviews as well for registration, but what does a mock inspection involve typically? How is it different?
So I think it's not that. I think you should try and do it as close to the real thing as possible, just so that your teams are prepared. So it would be things like checking the patient records are up to date, making sure that the daily checklists are up to date, policies that you've got, have they been looked at and updated in the last year? Are they localized to your place of work? Are all your key contacts in place? I think having questions for your staff, making sure that they know at the tip of their tongue who is the safeguarding lead, the infection control lead. I would look through folders in terms of doing the audits. Have we got everything we need for premises checks? Have we got up-to-date reports, leases, gas certificates, PAT testings, as close to the real thing as possible, making sure that you're ready.
Okay. And you can obviously do that internally, or you can get external help and support on that too, correct?
Yeah, correct. Someone from designated can do that audit and do the inspection, or you can get third parties to do it. You can have your registered manager do it. It's quite flexible, but it's good to have someone that really knows what they're looking for.
Great, thanks. And then I just linked to that would be, obviously when you go through CQC registration, you have a nominated individual and a registered manager. Typically, when it comes to compliance, would you both recommend that it's the registered manager's responsibility to ensure compliance, or does it a shared responsibility between them and the nominated individual?
I mean, I would personally say it's the registered manager, because you are legally responsible for the delivery of the service. And if anything was to go awry and you were to have to go to court, it would be you that would be legally responsible. So I would say take that very seriously.
I agree.
So and it, again, goes back to registration and the importance of nominating the right person to be in that role within the clinic.
Yeah, absolutely.
Yeah.
And actually, just touching on that, the nominated person, they have a legal responsibility, but the registered manager has more responsibility. And actually, the nominated person should probably be somebody who's involved with the business. So I know sometimes a lot of companies will want to add a director, which is fine, but if they have to speak to the CQC or are involved in any type of inspection, sometimes it can be quite difficult if it's not somebody who's involved in the business on the day-to-day. So again, I would always recommend that you really think about who the nominated individual is going to be.
Okay, that's great advice, Dion. Thanks. Please continue to post in the chat should you have any further questions or on anything. We can cover registration today as well. I think it's just really good to get a clear idea of where that responsibility sits. So if you've just come through CQC registration and you're not doing the things that we've talked about today, then ultimately it should probably be looking to the registered manager within your practice to get things up and running. We do get asked quite a lot about delays. Dion and Sarah, perhaps Dion, you can is it possible to push back an inspection, and what reasons would be accepted?
So you can request it. It's not something I would recommend, because I think that you're already starting on a negative, because they're going to assume that you're not ready. If you really had to, then the reasons that would be acceptable would be that perhaps your clinical lead is not available on the day. Perhaps your registered manager is on holiday, or the demands of the business that day is absolutely impossible for somebody to set aside 4 or 5 hours to sit with an inspector. So I have seen them come back and say we can delay it. They normally then just do it a month later, so you don't buy yourself that much time. So again, I would only really advise requesting a delay if you really, really need it.
Okay, thanks. And then we've talked, obviously today is all about ensuring compliance, best practice, ensuring that you sail through that CQC inspection. But if there is a common mistake or a common area where people make mistakes and there's pitfalls when it comes to inspections, what area is that? Sarah, perhaps you can take this one.
I think not being up to date with your documentation and just having your documentation in a good order. I think what can really trip you up on the day is not knowing where everything is, because if there's such a lot of information, you just need to have it clearly in categories. Some people like to have it printed out in a book. I personally like working with really clear folders. When we were first registering and I was a new registered manager, I remember that being difficult for me, trying to remember where I'd put everything to be able to show the inspectors. So I think that that's something to just be mindful of. Other things are policies. They like to read them in detail, and sometimes knowing that you don't have the time to read everything in detail can pick out bits that perhaps you might have missed, or something that's not local to you. They can find out if you've just taken a generic one. So that's important attention to detail, I think.
Right, thank you, Sarah. And I know that you touched on this in your presentation, but you've recommended to me before the idea of having everything in a folder online, but also having printed copies as well when it comes to the inspection. That can be incredibly helpful.
Yeah, I think so. They like to have things to look through, and if you've got it printed off, some people like to work that way. Just having everything in a good structure is key.
Okay, great. We've had another couple of questions. This one links in quite nicely with question 3 here, which is firstly, how long is a CQC inspection typically? And secondly, how often should there be? So if I've just come through CQC registration, when should I expect my first registration, and how long would it typically be?
Well, that's the question at the moment. So in the past, it used the CQC worked in a different way. So you would get your registration and you may not get an inspection for up to 5 years. However, we know that they've changed the framework and they're now working very differently. The plan that they're supposed to adhere to is that you get your license and within the first 6 months, they will contact you. However, because they are super busy, and as I'm sure many of you will know, they are inundated with applications, and I don't think they necessarily have enough inspectors to be able to fully deliver. We're seeing people not have their first inspection for 12 months. So you may have 12 months. It's not supposed to be that long, and it certainly shouldn't be longer than that. But at the moment, it's a little bit of a guessing game just because of how backed up they are. And then in terms of how often you should have them, again, the new framework is that they will come, they will inspect, and if they're happy to pass you, they'll pass you. There may be room for improvement, which they'll put in the report for you so you know what you need to do. They may then come back. And it might be that they leave it 3 months, 6 months. At the moment, the idea is that they can just spot check you to make sure that everything is in working order. If you were to pass with flying colours, and you got everything in working order, you probably wouldn't hear from them for about 2 years. And then again, they would start that process again.
Can I come in on that as well?
Yeah,
I found in my experience, sometimes they don't do the full-on inspections either. So if they were happy with your registration, I've then been contacted as well to just ask for a set list of documents and asked a few questions, and you submit that documentation and they'll review it. And if they're happy with what they've asked for and that you can provide it quickly and it's up to their level, that's also a kind of semi-inspection, and then you don't get a full inspection if you can satisfy that. So I've had sort of 3 years without an inspection by just having an interim measure like that in place.
And that's a really good point. And it goes back to what we've been saying about making sure that you have everything already in place. If you've got the procedures and you're following them and you're evidencing them, when that happens, then you should be absolutely fine. And you could almost help yourself a little bit, because then it means you won't have to have a full-on inspection. So that just shows the importance of being organized and ready.
Great, thank you very much. We've got a couple more questions that come through. So firstly, Natika says, I have registration, but don't have my first inspection yet. I'm a solo practitioner, but I have clinic premises and have one member of staff. I find it difficult to know how far to go and what is reasonable. Perhaps, Sarah, do you want to take this one?
Yes. So first inspection, solo practitioner. Difficult to know how far to go in respect of what, though. I'm wondering, can someone clarify?
Perhaps maybe what she's asking is around the level of compliance that you need to go. Perhaps, depending on the size of the practice. If you are a small clinic and it's just you and one member of staff, does your level of compliance, is that different to someone who perhaps is running a clinic of 10, 15 people, or the size of your previous clinic?
Okay.
Sarah?
I think it's still important. You might not need to do as many things, but it's still important that you can evidence everything in terms of the key lines of inquiry. So you can, as long as you can prove that the service that you're offering is safe, you still need to have all of your HR levels. Some things are non-negotiable, like you have to have all of your onboarding documentation, your annual appraisals. You have to make sure that your consultants are providing all of their compliance documentation. There's non-negotiables with things like HR and infection control. So in terms of doing those audits, cleaning checklists and stuff, I think it's better to be as thorough as you can be. Maybe you don't need to have such in-depth audits, but as long as you're comfortable that you can prove you're safe, effective, well, there is a little judgment there, but there are a lot of non-negotiables where you just have to do it.
Okay, that's really good advice. Again, Natika, do get in touch with us if you'd like to find out a bit more and talk that through. We do offer a free 30-minute call with any one of our kind of teams, should you have specific questions relating to both registration or compliance or any aspect of private practice. But thanks for the question. We've had a question from Lucinda relating to the fact that she is a director owner of an aesthetics practice. She's been in the NHS, but not aware of CQC in the private sector. She is, asking a question relating to, she's employing a consultant dermatologist. Is it best to ensure they are the registered manager, or would that role be better fulfilled by herself? So perhaps, Dion, you could take this one
on. Okay, well, I guess it really depends on if the dermatologist is going to be the clinical lead, then yes, absolutely, them as the registered manager would make a lot of sense. If it is going to be you, then you would need to have, obviously, the day-to-day interaction with the clinic. So if you're going to be there and you're working within the clinic, then you can do it. If not, then pass it on to the dermatologist. But either of those would be more than acceptable. I would just go on whoever has the most time to be efficient in what needs to be done.
And you need to be in the day-to-day operations of the clinic. We have some examples of directors that have taken on this role and they're not in the day-to-day, and that isn't suitable. That's correct, right?
Yeah, exactly. Yeah, absolutely.
But again, Lucinda, do get in touch. It's a conversation we'd be happy to have, and we can talk through the members of your team and who may be most suitable with the different options that are available to you. I guess one important point there as well is that you can be the registered manager and nominated individual for your clinic too. Yeah.
You can, yeah. And then you're solely responsible for everything. So that's also another option. But again, if you want to reach out, we can give you some more information and advice on that.
Yeah. And we've got another question from Samir, and we did touch on this a couple of times in the presentation around that idea of like the first step being, right, let's do an audit of what your policies and procedures are. Perhaps we could just talk through a little bit in the detail of that. How would you go about doing that? How long does it take? Perhaps, again, Dion, do you want to take this one?
Yeah, so again, it really depends on the size of the practice to how long it's going to take. And it will also depend on what you've already got in place, what you've been doing. Larger clinics are obviously, it's going to take a little bit longer. But I guess it really depends on what operating procedures you've got in place already, what paperwork you already have. Do you already have an organized SharePoint folder where you keep everything? Like, how organized are you? So that question is quite difficult, because I think it will be very individual to each practice. But again, if you want to reach out to us and give us a little bit more detail, then we may be able to sort of guide you on that.
Okay.
I'm just in the middle of one at the moment, so I've just got something to maybe add to
compare it to.
So I'm starting to do an audit on a company, and usually what I do is have a look at everything that they've got in place in categories. So in terms of HR, I'm looking at, have you got all of the documentations in the onboarding checklists? I'm looking for the consultant compliance. I'm looking for mandatory training and the dates. I'm creating a spreadsheet and a tracker that highlights all the greens and all the reds and the percentage of how ready you are in terms of that aspect of it. I would be checking your premises. Have you got all of the documentation that's needed? And then I'll be highlighting what's missing, and at the end do a report so that you can see where it's all fine and what the gaps are. And then I could take it a step further and actually collect some of this information if I had landlord details, for example. So that's what I'm in the middle of doing for one practice at the moment.
Okay, fantastic. Thanks very much, Sarah. A couple of short questions to kind of finish this evening, because we can see the time is getting on, but it's been really helpful, the Q&A, I think. So who will be interviewed on the day? So you have your CQC inspection. Is it just the registered manager and the nominated individual, or is it all the team?
So Sarah may have different experience to me, because obviously each inspection is different, but the inspections I've been part of, all of them have been different. So I had one inspection where they actually interviewed the nominated person, the registered manager, the clinic manager, who was not the registered manager, and then 2 members of staff. That was quite a large clinic. I also had an inspection with a surgical group, and they were quite a large group, but when we had an inspection for them, they only wanted to speak to the registered manager, a HR administrator, and a receptionist. So I think it really varies. I've had them wanting to speak to nurses at some locations, and then other locations where there are nurses, they haven't wanted to interview them. So I do think that it can be dependent on the clinic, and maybe they go by what evidence you're showing them. But I don't know, Sarah, if you've had a different experience.
I think it does change, and I think it depends on the inspector as well and what particular things that they're interested in. My last inspection was the practice manager, the clinical lead, one nurse, one receptionist, just a range, and that was a sort of medium-sized clinic. I think it definitely,
and that really highlights, doesn't it, that what you've been talking about in the presentation about this team approach, that it can't, all responsibility can't just sit with one person. The chances are that numerous people are going to be interviewed on the day, so that idea of continuous improvement and that building that culture of quality is essential.
Yeah, absolutely. And one little tip that I'd just like to add. So I think when we think of compliance, especially when you hear the word CQC inspector, it is a little bit scary. But I have to say that from all of the inspection experiences that I've had over the years, they've been really positive, and the inspectors are actually very lovely people. You'll get maybe 2 of them. So one of them might be a clinician, a GP, a nurse, and then you're going to get someone who's maybe more operational based. But I've always found them to be accommodating and actually very fair, and they want to be there to do a good job. They want you to pass. They're not, these people that come in black cloaks and want to fail everybody. So I think it's really key to keep that in mind when you're due an inspection.
So thanks, Leon. That's great. And I think probably the final question here, and I can see Natika's also asked a question about kind of taking on additional kind of practitioners under your own CQC registrations. Perhaps we can cover that one off. But if you are behind, you know, you're watching this webinar today and you're like, I'm panicking slightly because I've not been where I would like to be, what would be your first step? Like, what would be your kind of like, you know, the number one thing to do tomorrow morning? Perhaps Sarah, you could take this one.
Just know what you need to do, know what's missing. So I think it's the audit and the gap analysis, and then action plan. And
that can be done internally, right?
It can do a review, just find out where you are. It also might be helpful to just know what you need to know, like have a checklist. We can help with that.
And then perhaps just Dion, you mind taking one on Natika's question? So she is getting interest from other clinicians that want to use her premises for CQC. Obviously, they're looking for practicing privileges, which is something we work with practitioners on. If she was to get them onboarded and evidence this, etc., would that all be okay? What are the other things that she needs to consider when taking on additional practitioners?
So absolutely, that would be an option for you, and it's more than acceptable. Many clinics do it. And actually, I think that can be a real selling point for you as a business, that you have a CQC license. I think you just need to be prepared that you are legally responsible. So it's down to you to set the standards and the expectations of how you'd like them to work. So I have had examples of clinics where they've taken on maybe a GP or somebody who's not within their team that works a slightly different way, has a different system, and you just need to make sure that everything's aligned so that you can still evidence everything that's being done. You can ensure that they're collecting feedback. Normally, I would suggest that you get them to work to what your standards are already set as. So if you have your standard operating procedures, when you take on a new clinician, you would just say, this is how you're going to be working going forward. So just remember that you are the one that will be legally responsible for everything that they do within their practice with their patients.
Thank you, Dion. That's great. Sarah, anything you'd like to add there?
No, that was a good answer. And just in terms of collecting the compliance, just making sure that you get everything that you need. So the evidence of their professional qualifications and insurance, indemnity insurance, CV, and having a checklist of consultant compliance, which I generally keep on a tracker in my HR onboarding sort of checklists. I call it consultant compliance.
It's something we get asked a lot about because of the long waiting lists for CQC. Can I go and practice somewhere else? I think it's really important just to remember that, you know, they are operating under your protocols. You know, they can't come in and just start to practice how they want to practice and sort of circumnavigate CQC. It's your CQC registration they'll be seeing patients under. So just a quick point there. Thank you very much, Dion and Sarah. Brilliant. I think the Q&A, incredibly valuable. Lots of really good questions this evening. So thank you for everyone that submitted them. In terms of next steps, if what you've heard today, you kind of like is relevant to you and you'd like to set up a call with one of the team or Dion or Sarah to talk more about your individual kind of circumstances, then do just drop us an email at info@designatedmedical.com. We're pretty responsive, so we'll come back to you normally within 24 hours or one working day. We can set that call up and see if we can support and help you. Point you in the right direction. We do have a private practice WhatsApp group, which is growing in sort of size and stature, and it's an idea of sort of sharing ideas and knowledge amongst that private practice community. So, you know, sharing best practice and your experiences with CQC is a really good area, good opportunity. So do join that. And our webinar series continues into the summer and into the autumn. So next month, we are going to do one around busy doctors and something along the lines of the benefits of working with a virtual PA and how they can take some of that responsibility and admin off you. We know how busy everybody is. We see it day in, day out. But something along the ideas of spotting those signs and knowing when to reach out for help. The other idea that we are coming up with for July, before we take a break for the summer, is making the transition from doctor to business person. And this is something that we see as a real challenge for some practitioners, that they are not unfamiliar with what it means to run a private healthcare practice. So we'll be giving you some tips and advice on how to make that transition, which isn't easy. There's a lot to think about, from finance and CQC through to kind of marketing and websites and billing and how to manage staff. All of these things perhaps are quite new to you as a private practitioner. So that's something that we hope will come up in July. And then we ask for your feedback. So what do you want to hear about? So let us know the areas that you're finding challenging, what you'd like us to talk about. We organize these webinars monthly. Our agenda for the autumn isn't nailed down yet, so we'd love to hear your ideas, so do get in touch. And I think that is it for this evening. So thank you very much. A big thank you to Dion and Sarah for attending and presenting this evening and answering all those Q&As as well. So we hope it's been valuable. We will be sending around a recording of this, so bear with us probably until Friday or Monday next week. We'll also send you a PDF of all the webinar recordings, all 13 of them. And yeah, thanks for attending, and we'll see you next time.